I'm your host, Amberlyn Carroll. Thank you for joining us on Medwatch today. Teams across community health system have been working to reduce substance use in pregnant mothers and decrease the stigma that comes with it.
Substance use disorder during pregnancy has become a major public health crisis. It has paralleled the same kind of problem that we are seeing in the non-pregnant patient population over the past couple of decades.
Dr. Subhashni Ladella is the medical director of maternal fetal medicine at Community Regional and Clovis Community. She says there has been a major increase in women who are pregnant and battling substance use disorder.
It has increased and quadrupled over the past couple of decades. This encompasses all racial, ethnic groups, all socioeconomic groups, rural, urban, and suburban communities also.
Together with doctors Robin Linscheid and Mohammed Khan, these physicians developed a task force to train teams at Community about substance use disorder, create a more supportive birthing experience for pregnant patients battling addiction, and encourage more new moms to seek treatment.
A lot of these patients feel stigmatized and don't feel comfortable coming in for care.
Dr. Linscheid is board certified in family medicine and has seen firsthand how women struggling with substance use can be stigmatized and have a difficult time finding the care that they need.
As an OB provider or physician who delivers babies, I see a lot of moms coming in who are using substances, and a lot of them come in delivering without any prenatal care.
Patients battling substance use disorder often experience shame from family members and some healthcare providers, making them reluctant to seek care. But together, these doctors are hoping to help moms-to-be by providing a safe space where they feel understood.
We really want to make sure that it's open and welcoming for moms to come into care, both for their OB care, but also for their substance use treatment. They oftentimes have mental health disorders that need treatment or other medical conditions.
Some moms-to-be battling substance use disorder fear they may have their baby taken away if they ask for help. But Dr. Linscheid said reaching out for care would have the opposite effect.
By coming into care and providing that multidisciplinary care, then one, we can support moms, but also it shows protective agencies that they're willing to show up and that they can show up and that they're healthy and able to care for their baby.
Dr. Mohammed Khan, an addiction specialist with UCSF Fresno, says many patients with substance use disorder have a difficult time finding the treatment they need.
The fact is that all these patients have ready access to the different drugs that they are using. And if they have a harder time getting into treatment, then the disease that they are suffering from makes it harder for them to find that treatment.
Dr. Khan says nursing leadership at Community Regional has already committed to increasing access to care for moms-to-be battling substance use disorder by educating and providing resources to various departments within the hospital.
This will translate to increased access to care because nursing are advocates for patients, and they often see things differently and earlier than even sometimes the providers do.
Over the last year, the task force has seen a major increase in the number of patients who are seeking care, and that number will only continue to improve the more providers and public know about treating those battling substance use.
We will continue to educate more and more people in the hospital and in our community to become allies to change the landscape for treatment for patients suffering from substance use disorder, especially during pregnancy.